While we're waiting for everyone to join, I will drop a poll in so that we can just get a sense of those who were able to attend our session last week, Menopause 101 by Gennev. So go ahead and that poll should just pop right up and you can just answer so we can get a sense of that.
Is with the avatars.
All right. Since we have a fair number of people here, I want to make sure that we use the most of our time. So we'll go ahead and get started. So good afternoon. Thanks everyone for joining us for the Q&A with Gennev providers. If you attended our Menopause 101 session last week, then Gennev's Director of Lifestyle Care, Stacy, she's a familiar face. Today, we're also joined by Gennev's Medical Director, Dr. Yashika Dooley. And my name's Devin McGill. I'm the Director of Partnerships with Gennev, and I'd like to invite you to participate in this session by dropping your questions in the chat or coming off mute to ask your questions. Just want to give you guys a heads up. We can't give personalized medical advice in this session, so we'll just give general advice. But if you find that you do need more specific medical advice to your situation, we definitely recommend that you make an appointment. So Gennev has an exceptional collaborative care model between our doctors and our registered dietitians, which is why we have both represented here today to answer your questions about menopause, what to look for, how it impacts us, and how we can get relief. So to get us started, I'll follow up with some questions from last week's session. So Dr. Dooley, can you help us understand, how do you know you're in the menopause transition? Do you need a blood test to know that you're in menopause or to start HRT?
No, you do not need a blood test. I tell women we really just go off of your symptoms. So most women will start noticing that they're having irregular cycles. Maybe their cycles are getting longer between them, or they have lots of heavier flow. They're also noticing that they're having symptoms of hot flashes. So when you start having symptoms, I think at least that's a great time for you to come in and talk to somebody. And then depending on where you are, how symptomatic you are and how you feel, we can then start talking about if you want to start on medication or if you want to do some non-hormonal kind of treatment. And really, when you're in that perimenopausal period, if we were to do blood tests, I tell women they are going to be all over the place. And it does not give me an idea of yes, you're in menopause or yes, you're in perimenopause. And at that point, we're just going to treat your symptoms.
That's great. Thank you for that. Another question that came up is, do I need testosterone treatments? What's all this I see about low T?
Yeah, you do not need testosterone treatments. And I actually advise my patients against having testosterone treatments. A lot of women are concerned that because they have low sex drive or low interest, or they feel like they have low libido, that if they use testosterone, that's going to be the cure. And I just tell women testosterone is a steroid. It will make you feel amazing because that's what steroids do. But they're also very dangerous. And so, when you are using them and when you are, you feel good, you're going to need more and more to get that same kind of feeling. But also, there are the risks. So, deepening of the voice, and you have the risk of having male pattern baldness. And a lot of times, these compounds or hormone the medication is compounded. And when you go to those pharmacies, there is no regulation. So we have no idea of what you're getting, how much. There are just so many risks when you go that way. And it's not something that goes down in women that still have ovaries intact. And so there's no reason for you to be supplementing it because you're concerned that it has decreased.
That's super interesting. Thanks for that. So for those of you who have joined, feel free, drop any questions that you have in the chat. I'll continue to ask the questions that we know come up pretty regularly or questions that I myself had. as someone who's going to be entering into perimenopause at some point. And so I'll just keep asking the questions, but would love to hear from the group what questions you guys have as well. So Stacy, I'll direct this question to you. This is a question we get all the time. Why is weight gain so prevalent in menopause, and what can I do about it?
Yes, this is a big question. One of our top symptoms that we see women report, even from our menopause assessment, is the weight gain. And I think the biggest concern a lot of our patients have is I am doing the same thing I've always done. How come all of a sudden it's no longer working? And I feel like, excuse me, I feel like I woke up one morning and I just had all of this weight around my stomach. What happened? And so, at first, I want to acknowledge that a changing body, when it feels like it's out of your control, is uncomfortable. And that's often where a lot of women are coming from, just feeling out of control, feeling uncomfortable in their body. And that is certainly hard. There are multiple factors here, some of which when we look at some of the research and the data, we see multiple contributions, some of which we're still learning about. But there certainly is hormone changes happening, as we know. And there's one, in terms of the decrease in estrogen, we know that that is happening during this transition. And it's a challenge to the body, right? The body detects this change in estrogen and says, oh, wow, this really important hormone is decreasing. What can I do to help? And so one thought is that there is this mitigation effect happening in terms of the body putting on body fat, perhaps related to the fact that body fat does secrete estrogen. Now, it's not the same exact estrogen, and it's not going to mitigate all your symptoms or replace what is lost, but certainly there may be this compensatory mechanism happening at a physiological level that the body's trying to counter what's happening. Now, I always bring that up to patients. Most patients don't know some of the physiological impacts, and I bring that up in terms of let's recognize the fact that there's changing physiology happening in your body. So, if your physiology is different than what it was pre-menopause, then the strategies you are using pre-menopause to manage weight or to support even your health at that time may need to be different to support and work with this changing physiology. So again, we're looking at all of those factors there. And then the other piece that we see at this time of life, and this is actually for in male and female, we see a decrease in muscle mass. Oftentimes, we may be just more sedentary. If you go from working and then being retired, sometimes we don't realize how much just walking out to the car, parking our car in the parking lot, walking into an office, all of a sudden we decrease that level of activity. So those are some of the factors that come in there. And then if we think about strategies, so coming back to working with the physiology, there's a few things that typically I start off recommending, and then we personalize to your individual situation. So first, we want to think about when we're looking at nutrition, the primary things I typically recommend focusing on as a starting point are protein and fiber. Keeping it pretty simple. Often I find the tendency for our patients is all of a sudden body weight is increasing, so I need to exercise more and I need to eat less. That puts more stress on the body. That tells the body, hey, I'm in a higher stress situation. And the mechanism, again, when you're fighting against the physiology, the body's going to also fight back. And so that may not work as well. So thinking about what can we add in, adding in protein, we can support that muscle mass by adding the building blocks that are needed there. And protein also supports satiety. So you feel more satisfied with the foods that you're eating, which in turn may help decrease the total calories you're taking in. The fiber piece is also related to multiple factors. Certainly, fiber is going to help related to blood cholesterol and decreasing risk of heart disease. But again, we have satiety factors there, and there's also support to our gut microbiome, especially when we're using plant-based sources of fiber to help support that. And there's potential mechanisms in terms of the microbiome and regulating our body weight as well. On the movement side of things, the key thing here, if you aren't already, I would recommend adding in some type of resistance training. And then the next layer to that is you have to keep increasing the challenge. And this is a catch 22 with both cardio exercise as well, and strength training. Oftentimes, we'll say, I am doing strength training. And then I'll say, how hard is it? And well, I've been doing the same thing for a few years, which is awesome. Don't get me wrong. Movement, exercise, anything you're doing in that way is still beneficial. But in order to, once you've adapted, your body adapts, your fitness levels adapt to that. In order to continue to progress and change those fitness levels, increase that muscle mass, you got to up the challenge a little bit more. So we can, and with our patients, we go into the details of what that looks like for each individual. We take into account injury history. Certainly, one of the things that comes up often is joint pain. So we want to make sure that we're working within those limitations to support you in finding movement and eating patterns that work with you during this time. Sleep is another factor. Poor sleep can impact certain hormones, hunger and satiety hormones, and also energy to exercise. So those are a lot of factors that we weave in to make sure we're helping you find a plan that you can sustain. That's the other part. You got to find something you can stick with. I tell people, can you do this for the rest of your life? Because that's going to be the key factor. And so we want to make sure we're helping you dial that in.
Thanks for that answer, Stacey. And what I heard so much from what you're saying is so much science and research backed evidence-based medicine, which is super important here at Gennev. And so I just really appreciate you really weaving that in and making us understand the science behind what's happening in our menopause journey, because I think it's really critical for us to understand that so we can really understand what's happening in our bodies. So we have a couple questions in the chat. So Dr. Dooley, can you give us an understanding at what age does perimenopause typically start?
I usually tell women to start looking for symptoms maybe around like 45, 47. You will have a better idea if you have a mother and you know when she went through menopause, or sisters, right? And how long it took them to go through that menopause and perimenopausal journey. That can give you a better idea. But usually, if women start like in their mid 40s, will start kind of feeling different types of symptoms. And it's going to kind of vary, right? Because if women are on birth control pills, or if they're on an IUD, they may not have irregular bleeding, or they may not have some of the symptoms that women are commonly starting to complain about in that age range.
Great. Thank you. I think this might be a question for both you, Dr. Dooley, and for Stacey. Does
Okay.
having hypothyroidism or other hormonal imbalances make going through menopause more difficult for women?
Yeah, I would say it definitely does. Hypothyroidism or any other kind of hormone imbalances at baseline are going to throw off your metabolism. I mean, people that are hypothyroid, they're going to have decreased energy. A lot of times they have lots of other symptoms where it's hard for them to lose weight. It's hard for them to feel good. They can have balding of the hair. They also will put on weight. They have lots of joint pain. And so if you are having all of those symptoms just from being hypothyroid, and now you add on whatever symptoms from being perimenopausal or menopausal, you're definitely going to feel much worse. And so I think there is going to be that additive compounded effect. And you're going to feel like you're really going uphill because you really have to attack both. So just because you're on maybe hormone replacement therapy and doing all the things for the menopause, if we haven't addressed the hypothyroidism, those issues are not going to clear up just because you're on HRT. So we really have to look at both and address both issues, get your hormones in balance if there's like a hypothyroid or whatever. And then also look at, okay, what other symptoms are you having that are due just to perimenopause and menopause, and try to address those as well.
Great. So, Stacey, do you have anything that you want to add there?
No, I agree with all that Jashika mentioned here. And again, when we're looking at the complexity of hormones, right? The thyroid hormones play a role into that. And then we're bringing in other hormonal changes. And I always think about it through the lens of these are stresses on the body. So I also think about
Yeah.
what other stress is happening in your life. And that's where on the lifestyle side of piece, certainly managing hypo or hyperthyroidism is a discussion and collaboration with your physician or endocrinologist. But on the lifestyle side of things, where else can we look to reduce stress? And that's often what my team and I will also work with on. Okay, how can we help you set boundaries, take things off your plate, figure out your priorities, get in deep breathing, a mindfulness routine, or even that movement routine, which can also be a great
Yeah.
stress management strategy.
That's so great. And I think it really highlights what our RDNs do. So even though I'm not in perimenopause, I do have an RDN who I work with at Gennev. And those lifestyle changes and those impacts to your stress are so important. And I know, Dr. Dooley, you do a lot of work on this as well with other doctors and for yourself in terms of just managing your overall lifestyle and how do you find places to reduce stress. And so I'm super appreciative of kind of how you guys work together to support our patients in that, because I think it's more than just HRT, right? There's so much more to that. And so I just really love how you guys both support patients in that way. One question that generally, from what I've heard from our doctors, that comes up at the end of appointments, just right at the very end, has to do with sexual health and libido as you go through your menopause journey. So, Dr. Dooley, can you help us understand what's the impact to libido during menopause and why does that happen?
Well, it's really multifactorial. I think it does have to do with, there's the emotional component. There is the stresses that people are feeling. There are also the hormones that are going on. But for a lot of women, there is also kind of like that psychological component, right? When you're not feeling good in your body, in your skin, when you don't feel sexy, when you feel like, you have this added weight, you're not getting sleep, you have brain fog, it's harder for you to engage in all relationships, but especially with your partner. Maybe you're just feeling in general, just kind of blah. You're just not in that emotional space. It's hard to really be like, yes, this is the thing that I want to do. I feel like I want to, be intimate with my partner. And oftentimes there is also just the stress that perimenopause and menopause puts on that relationship, that it just makes it hard, that there is maybe not, the communication is not there, the connection is not there. For women, it's more than just the desire. It is, we have all of these pieces that come together to be like, okay, now we are ready. We want to be intimate. And if you have lots of things swirling in the back of your mind about your body, about your kids, about work, about whatever else, it's hard for them to like really just engage and focus and be like, I'm going to shut all that down and really want to be intimate. And so I think for a lot of women, they have to realize they may not have this strong urge or desire like they had in their 20s or like their partner may have. And so sometimes you have to kind of be like, okay, I'm going to set some time aside. I've got to shut all of this other stuff down, especially if I know that I enjoy intercourse and I can have orgasms and I enjoy being with my partner. The urge may not come first. I might have to, do some other things to get me in the mood and have more foreplay and all of that, so that then we can get to that point where I can have intercourse. For other women, sometimes what comes up is that intercourse is now painful, and it might be because the tissues are thin and they're atrophic, or maybe the muscles are irritated. And so if intercourse is not pleasurable, that's the other component that we then have to address, because if sex is not enjoyable, of course they don't want to engage. And so those are all of the type of questions that I start asking my patients, because it becomes a deep dive. It's not just one little fix. It's like, okay, what are the things that you enjoy? What are the reasons why you're not able to enjoy it? What can we fix? What can we work on? And trying to like really break it down so that they can get to that place where they want to engage in intercourse. Intercourse is desirable. They enjoy it. They can have an orgasm, and they can also still have that connection with their partner.
Great, thank you. And I love that answer, because I think there's so much that people don't understand how menopause not just impacts the person that's experiencing menopause, but those people around them. And so partners often are feeling the impacts of the menopause journey without really understanding exactly what's happening. And so I think you spoke a lot in that answer around how your partner can support you if you do have a lack of libido. Are there other things that partners should be aware of in terms of how to best support their partner through this menopause journey when it comes to hot flashes and brain fog and lack of sleep? Are there any kind of tips and tricks that you recommend?
I just say really being supportive and validating what is going on. I think for a lot of women, they feel like they're all alone. Nobody understands. They're talking about these symptoms. They feel like they're out on an island by themselves. And it's kind of awkward, right? You're all of a sudden having a hot flash. Everybody in the room feels fine, and you're busting out. You're getting red, you're sweating, right? And you're like, is anybody else hot? And everybody's like, no, it's just you, right? So when you're constantly being told it's just you, it can feel very isolating. And when you're going to see medical professionals and they're telling you there's nothing you can do about it, this is just normal, you just have to carry on, it can feel really overwhelming that you are kind of stuck in a place that you don't want to be and you don't feel like yourself. So I think if spouses or partners or families can just help to support them, to validate their symptoms and to let them know, like, however we can help you, we are there. I think that's really a lot of what they need in that moment, because oftentimes people just feel like, am I crazy? Is it just me? I'm the only one going through this. And that's a hard place to be.
Great. And Stacey, as our director of lifestyle care, I think so much of what you talked about is reducing stress. How can partners help to support in that lifestyle journey?
That's a great question. And it's really great to see we have had some partners reach out directly through our website chat or even email in saying, my partner's going through this. I don't know what to do. What can I do to support? And we love to see that out there. And I think a lot of what I hear from patients who maybe don't have supportive partners are, I wish my partner would just listen. So being that opening ear or opening our listening ear to what they're experiencing and validating what they're going through and the difficulty of it. Like Shika said, that if they are feeling all of this in a place of loneliness or like isolation, that's going to be really hard. But so even validating that can help to make them feel less isolated. The other thing, I have had some success stories with, and this comes back to the libido piece, because obviously that typically doesn't have to, but if someone is looking to be intimate with their partner, takes the partner as well. They have read one of the books that a lot of our doctors recommend is Becoming Cliterate. Oh no, that Becoming Cliterate, or a passionate guide to help me out here. It is and I'm blanking on the name. Um,
That's good. We'll
Doctor.
find it and drop it in the
Yes,
chat.
we'll drop
No
it in the
worries.
chat.
No worries.
But
Yep.
it is a book on intimacy in a tired woman. Thank you, Rebecca. A tired woman's guide to passionate sex. There it is. And I've had couples read that together. Literally, I have one patient that it changed their intimate relationship. That she was going from one time where, or one period of time where she and her husband had been very intimate. It was really a big part of their relationship, to she was afraid of and no longer wanted to have any type of intercourse, and it was a strain on their relationship. And I remember the appointment that we had after she had read this book. She had met with one of our doctors. She had also done pelvic floor PT, so again, all putting all the pieces together here. And she said, we had sex twice in one day. And it was just one of these things that was like, it is possible. And just to be able to bring that part back. But again, it took both of them to be able to find that support.
Great. I love that. So we have a question in the chat. So after a hysterectomy, what is the best hormone therapy treatment? And the issues are regarding aches, joint pain, weight gain, lack of sleep. I would say this is definitely like a pretty specific personal kind of question, which is great. So we'll have Dr. Dooley give kind of a general answer. If that doesn't answer your question, definitely feel free to book an appointment.
All right.
I would say there is no one best therapy, right? And so, and it really depends on, why do you have the hysterectomy? what is your medical history? Like, because I need to know, like, have you had breast cancer? What are the other comorbidities that you have? Do you have hypertension or diabetes and all of that? Kind of what medications are you on? And what are the other symptoms that you really need to address? And looking at what have you maybe tried before, and what are the things that are going to make you feel your best in the moment. And then we typically start talking about, okay, do we need to replace the estrogen, right? And how is the best way to do that? For a woman that's had a hysterectomy, they don't need progesterone. And so that's why I bring that up, because I know sometimes people are thinking, oh, I need both. But it's like, okay, how can we supplement your estrogen? What's the best way to do that and to get you feeling your best? And so those are kind of the questions that we typically go through when you book an appointment, that we kind of talk about what's going on now and how do you want to feel, and like, how can we give you the symptom to control using the lowest dose of the medication, and what also maybe some of the non-hormonal things that we can layer on top of that'll really optimize you feeling your best.
Great. That's really helpful. And Stacey, I just want to come back to our chat about weight gain in menopause. Is this inevitable as I start my menopause journey? Am I just expected to gain like 20, 30 pounds, or is this something I can prevent now?
Thanks for coming back to that, because I don't know that I did a great job of talking about the changes that we do expect. So it can, couple of things that we do see when we look at the research. Typically, the most transient time of symptoms, and even when we're seeing the weight gain, is during that perimenopausal phase. So before that menopause, that 1 year anniversary without a menstrual cycle, that typically has more symptoms and more of those weight or body shape and size changes. And then after that, not for maybe not everybody, but majority of individuals, it starts to plateau or slow down. I think one of the things that a lot of women ask me, like, is this just going to keep happening? Am I just going to have to keep buying new clothes? Like, when is it going to stop? And that uncertainty is certainly concerning as well. But I think there is, one thing our society does not do a very good job at is acknowledging the changes that happen with bodies through aging. And this is, um, male and female. This spans all genders in terms of with age, our bodies change. And sometimes that also includes shape and size. And so, often that fighting of those changes can be exhausting. And I do find that this may feel ironic or counterintuitive for some people,
Yep.
but when you are able to recognize that there may be some changes here, you're more able to engage in the activities that then can further support your health, regardless of weight loss. So sometimes, it's important to remember that if you are engaging in exercise and improving your nutrition and sleep and stress management, and you maybe don't notice a number change on the scale, that doesn't mean it's not working in other areas. So again, that's where the dietitian team also works on, is helping women to also understand, come to terms with some of the changes that are happening, while also implementing habits that can mitigate those changes, as well as support long-term health and wellness, which is also a goal of all of the clinicians at Gennev too, is not just to help you feel good now, but let's help give you quality to your years, that we're hopefully extending long term.
Great. That gives me lots of hope. So super appreciate that. I work with Katie Linville, who is an RDN through Gennev. She's fantastic. And so she definitely helps me kind of feel good about where I'm at in my life and supports my journey, and definitely makes me feel like, I can accept my body as it is and the way that it's growing and changing, which is fantastic. So I just want to say thank you, Dr. Dooley and Stacey, for this great session today. I've learned so much, and I hope that all of you that joined learned a lot as well. We'll send out the recordings of this session if you want to go back and watch. This is also a great session to share with friends, colleagues, spouses, anyone who you know that is curious about the menopause transition. I just want to close out by saying Gennev is covered by insurance. We have coverage in all 50 states. So if you have found during the session that you're ready to book an appointment with one of our menopause certified trained OBGYNs, please visit our website, set up an account, and get started on your journey. So thank you all so much for attending, and happy holidays to all of you. Thanks so much.
Thank you all for joining.